Cardiopulmonary resuscitation, or CPR, is a combination of chest compressions and rescue breaths. Good quality CPR gives patients with cardiac arrest the best chance of survival. The critical concepts you should learn from this course are: pushing the chest hard and fast, compressing at the rate of 100 compressions per minute, allowing full chest recoil after each compression. Minimizing interruptions in chest compressions, keeping interruptions to 10 seconds or less. Avoiding breathing too forcefully and deeply for the patient. CPR should be started immediately, without delay, to be most effective. To give effective compressions, make sure that he or she is lying on their back on a firm, flat surface. First, quickly move or remove from the front of the chest clothes that may get in the way of doing compressions. Put the 2 fingers on the center of the bare chest, just below the nipple line. Now, push straight down on the infant's chest, ensuring that you are pushing directly on the breastbone. When treating infants, you should press down 1/3 to 1/2 the depth of the chest. After each compression, let the chest come back to its normal position, ensuring full chest recoil. This allows blood to flow into the chest and heart. It's good practice to lift the fingers slightly off the chest to promote full chest recoil. Give 30 compressions at the rate of 100 per minute, counting out loud as you press. Remember what you are trying to do. Squeeze the heart and pump out the blood to the brain. When you stop pressing the chest, the brain stops getting oxygen, so keep pressing. Now give 2 rescue breaths. This is done by placing your hands, as you did with the initial assessment, on the forehead and the bony part of the chin, and tilting the head back. Open your mouth wide and cover the patient's mouth and nose with yours. Breathe into the infant's mouth. Breathe gently until you see the chest rise. This should take about 1 second. If one breath does not result in a chest rise, reposition the head and try another breath. Without delay, start compressions again. Perform 5 cycles of 30 compressions and 2 rescue breaths. Then stop and recheck breathing. If 112 or 999 has not been called, call it now. If the infant's condition is unchanged, continue CPR until the infant starts breathing, or until you are relieved by somebody else who is capable of giving CPR. Your instructor will now take you through the steps of CPR for infants in your groups.